here at A Beautiful Smile. I would like to take time to introduce you to Dr. Efema Nwajei.
Hi, Edna.
Hi.
Thanks for having me.
Thank you for allowing us to be here at your office today.
Welcome.
Can you give us a little background about how you got into dentistry and how long you've been here in Fresno, California?
Well, that's a long time ago. I've been practicing for almost 20 years, and I love dentistry. I always wanted to go into the health field as a little girl, and so that's where my interest sprung up from. I wanted to help people, touch people, heal people as best as I could, and dentistry was the field that afforded me that opportunity. So here I am, 20 years later, almost at the Central Valley. I first started my career in Nigeria, and then we moved to the United States over, almost 20 years ago. I went back to school, New York University at Manhattan, in New York. I got my dental degree in the United States at that point. And then I lived in New York for about a year or so, moved to New Jersey, lived there for some time, and then here we are in California. So a little story about how we got to California. My husband's a physician with Valley Children's, and he decided to come over here for an opportunity as a neonatologist. And 7 years ago, sure enough, we moved to Fresno. So I've worked in different dental practices in the Valley. I've also donated my time in several charities right here in the Valley, giving my time back to the people. I love Fresno. It's become home for us.
Oh, okay. Now, all right, tell me a little bit about your family. How many children do you have?
I have two wonderful kids. I have a son who's 17, soon to be 18. He's a senior at one of the high schools right here in Fresno, and I have a daughter who's a freshman. She's 14.
Oh, okay. What school does she go to?
They go to Clovis now.
Oh, okay, wonderful. So are they going to follow in your footsteps?
Nah, they said it's too much work.
Yeah, it's nerve-wracking studying, right?
It is nerve-wracking.
And how many years does it take to complete a study in dentistry?
Well, you do your bachelor's first, so you get a 4-year degree, and then you go back for another 4 years.
Oh, okay, so a
some
total
time.
of eight?
About 8 years if you're not specializing.
Oh,
That's a different story, another 2 to 3 years if you're specializing, and if you're going to do surgery, another 6 years.
An additional 6 years? Oh my goodness, how could you survive that long? That's
We're well trained when we come out, so we know what we're doing.
So why don't you tell us a little bit about your practice and a little bit about, specialties that you have.
Okay, so I believe that smiles are a gift in any language. I believe that people should be given that opportunity to be able to express themselves with a smile. Smile is like a kind language. You smile at somebody, you melt their hearts. It's like a warm feeling. So we're all about health right here at A Beautiful Smile. So we believe very much in looking into the patient's mouth, building their own blueprint with the patient's input. I like to know what my patient wants. I like to know where they're headed. I like to know what their ideas are. So I'm not on one page and they're on a different one. If we marry the ideas together, then we can move them from a state of disease to a state of health. We do several services here, from the basic preventative services to things like Invisalign. You asked me about specializations that we do here. I do offer Invisalign, which is the aligning teeth in a better position. We talk about crowding. We talk about teeth out of alignment. We talk about, there's no such term as crooked teeth, the teeth out of alignment. Because once you move them into the alignment they should be at, everything looks beautiful. They're not crooked. They're just out of alignment. So Invisalign is one of the things that we do here.
Okay. So I have to let you know, I have braces. You're my doctor.
Yes.
So you know that.
Yes.
And Invisalign is a lot different than the type of braces I had. Those
Traditional wires.
Traditional wires.
Yes.
So can you explain that a little bit to everyone?
So the difference with Invisalign is that it affords you an opportunity to clean your teeth better. It affords your dentist to be able to do your checkups and see if there's any cavities in the mouth. There are some procedures or there's some diagnoses that would need or require traditional braces. So when it gets to that point where we might have to do something very comprehensive, and we have to go that route. But for everyday malalignment, Invisalign is perfect, especially for adults.
Oh, okay.
They're not self-conscious. They have no brackets on their teeth, and if they qualify, why not?
Okay, is that something you can put in,
You
place
put in-
in, and take out every day?
Exactly. You put in and you take out. You take them out to eat. You take them out to brush your teeth. You can socialize with them on, and nobody knows your business while you're straightening your teeth.
So can I ask a question about
Yes.
the pricing? Because I realized that when I had those metal braces on my teeth, it took quite a long time to get them to somewhat straighten out. And then also you had to replace the metal
As
wires.
they pop up, yes.
Exactly.
So Invisalign kind of works similar. The difference is that instead of the metal brackets you have on your teeth, we have tooth-colored attachments or buttons, if you will, placed on the teeth. There are different price lines for Invisalign, ranging from easy to more comprehensive. So you could fall in between any of those. But they're affordable because there are different finance options that many offices will have for their patients, so that way it will fit their budget.
Oh, okay. So, and does it help straighten the teeth faster or align the teeth faster?
In some occasions, yes.
Oh, okay.
Some others you may have to wear them for the up to 18 to 24 months.
Oh.
You know, you mentioned bruxism as you were talking, or grinding of teeth as you were talking. Some patients really think it's their normal to grind their teeth. Some people really think they need to have a little bit of pain because they've had it for so long they don't know that it's not normal. Some people think it's okay, I wake up, my jaws are tight in the morning. Now those are not normal things. Things changed. Once the patient adapts, they kind of are balanced for a minute and then it changes again. And so the pain can come back. So you do hear people talk about TMJ. So I do treat many forms of TMJ. If it gets to the point where the joints are too badly deteriorated, then we'll send them to the specialist. But when you have people waking up with soreness, they're grinding, their muscles are tight, we have what we call bite splint therapy. And we do that for the patients. It's amazing what the bite splint does for the patient. It helps them reduce or remove or take away their headaches almost completely. And then that action of grinding, because the splint is on, they don't destroy their natural teeth or their crowns anymore. And that way, they're not waking up with headaches.
So let me
or
ask you
tension.
real quick. Bi-splint is that
An
something-
appliance you will put on,
Okay.
correct.
Okay.
And the appliance, what it does is that it helps the jaws to relax and helps them to sit back in the cave where they belong. We have a little area in the head like that where the joints sit.
Right.
So many times the joint doesn't get to where it is, and because of that action, there's grinding. So the jaws move very subtly like this, back and forth. We wouldn't even know that we're grinding many times. People might tell us, I hear you make that weird sound when you sleep. Or you wake up and you're like, oh my goodness,
It
this
hurts.
aches.
I've had that.
What have
hurt.
I been doing, you know? Or some people actually get stuck, open or closed.
I've gotten
So-
stuck before, so I know.
And
And
it's-
that's not a
it's
good
scary.
position.
And it's extremely painful, but we do
Yes.
treat that. We treat TMJ, we treat bite disease as well. And it's one of the goals we have. We're all about health in this office. The health of my patient is my priority. And I believe that if you're healthy from the mouth, you most likely be healthy everywhere else.
Yes, true. Yes. So, doctor, explain to our audience today about how long it takes to go through some of these reconstructive processes.
Well, like anything good that the outcome is good, it's going to take some time. So we have anywhere from a few months to a year or two. The idea and the goal is that you are gently reconstructing and helping the muscles and the brain accept what it is that you're doing. So it could take some time. Some patients for full mouth reconstruction, for example, where you're changing the dynamics of a patient from disease to a health model, you might need to put a patient in a splint for about 6 months, maybe a year. You might need to do a little bit of alignment first for another few months before you actually start that journey of repositioning teeth, of crowning teeth, doing veneers, or balancing the bite. So that's what the comprehensive full mouth reconstruction is about. It's not just about putting crowns in places, but it's about understanding that when you're redoing somebody's smile, you want the outcome not just to be pretty, but you want it to be predictable and you want it to be healthy. Those are the goals.
Now, I noticed you mentioned something about the brain accepting it. So
Yes.
you're saying that our programming up here needs to be redone every step of the way. Is that
And
what I
that's why you
understand?
do it gently and not at once. So that way, when you're reprogramming, you do it little by little, and the brain accepts what you're given that's new and improved.
Okay, so this would be the place for someone that has been in a car accident that,
This could be the place for that person, absolutely.
yeah.
Yes, we'll work hand in hand together to bring it back. In fact, we have some cases like that where they've lost front teeth, they've lost some tissues from the front, and they have to do a grafting first and then implants, and they were going to come in with the crowns later on. Absolutely.
Okay. Well, Doctor, this has been a very interesting interview and a lot of great information for our audience, and I really appreciate you taking the time to allow us to come into your office and interview and learn more about your business.
Thank you so much, Edna.
Thank
It's
you.
been a
Thank
pleasure.
you.
Thank you.
Thank you.